This course is brought to you by USAA. We would like to thank USAA for their generosity in making this course possible.
Welcome to this series on caregiver resilience. We value your tireless work as military and veteran caregivers and know the unique stressors you face. We hope to provide you with helpful information as well as tools for strength and support as you navigate the way ahead. Thank you for taking time out of your busy schedules to join me for this brief discussion about problem substance use and its increased risk for people who use substances during stressful times. We're living in one of those times. The far-reaching effect of the coronavirus has no doubt greatly impacted nearly every aspect of your lives. If you're worried about your own substance use or are caring for someone who's using substances too much, things probably feel pretty complicated right now. Even if you don't experience problems related to a substance, you might be feeling like you're using substances more right now to help you cope with stress. You're not alone. So what's important for you as caregivers to know about substance use and what causes it to become problematic during stressful times? First, it is very common for people to turn to a substance to help cope during stress. Substances affect our brains and bodies, some in ways that make us feel better temporarily. Opiates reduce pain. Alcohol, benzodiazepines, and other depressants slow down or relax us. Stimulants like caffeine, nicotine, cocaine, and methamphetamine keep us awake, moving, and thinking more quickly, and can affect perception, with people saying they experience both relaxation and pain control with its use. As people struggle with depression, anxiety, relationship strain, sleep problems, and even thoughts of suicide, it's understandable that they might look to self-medicate. During times of distress, this happens more frequently. Surveys have shown that Americans say they're using substances more since the coronavirus pandemic changed their way of life. Second, isolation makes it worse. Research studies show that social isolation dramatically increases the risk of taking drugs, and if a person's already struggling to cut down or quit using a drug, isolation increases risk of relapse. During times like these, when people are quarantined, distant, and feeling disconnected from the protective social support systems in their lives, it is vitally important to watch out for those at risk for problem use of substances and connect with them however you can. Third, people who abuse substances are at greater risk for complications or death from coronavirus. It's well established that people who smoke, either tobacco or cannabis, or vape, have increased risk for serious lung issues and fatality if they contract COVID. Those with opioid use disorder are at increased risk for overdose due to respiratory problems caused by the coronavirus. In addition, with social isolation, it's more difficult to obtain the treatment and support they need to get or stay sober and manage their problem use. In fact, some have commented that the coronavirus pandemic is a trigger within the opioid overdose epidemic, each making the other more dangerous. It's critically important that loved ones of those who use opioids have access to naloxone, the life-saving antidote to overdose, and talk to everyone in their lives about how to use it. Each one of us can be part of saving a life, right now. Talk to your doctor about how to be part of the solution for someone you're concerned about. Substances can offer an escape when life feels difficult. They can help manage feelings of fear, depression, anxiety, and loneliness, and many people turn to them for those reasons when they're feeling very stressed. Give yourself a break and be kind to yourself. But during these times where isolation poses a risk to you and those you love, it's vital that you as caregivers take care of yourselves by keeping an eye on your own use and the use of the person you're caring for. Ask for help if substance use is interfering with your life. In addition, by staying connected to those that you love, you provide a lifeline for people who might be struggling to get or stay sober. Thank you for all you do, now and always.
Thank you for taking the time to learn about this important topic and about our nation's military, veterans, and their family members. If you have any questions about this course or need assistance, please visit the PsychArmor website or call the Psych Armor support line at 844-779-2427.